I found this pen this morning, and it finally inspired me to do this edit. In 2019, I was selected with 4 of my colleagues to go witness one of the many efforts that IKEA is doing to better the lives of the many people. This is my journey with Doctors Without Borders in Eswatini, Africa, fighting the tuberculosis and AIDS crisis that is spreading rapidly across Eswatini for years. Both AIDS and tuberculosis have been killing off the population. This is why Doctors Without Borders are here.
Fantastic, best sleep ever.
Time for some breakfast?
Yes, I'm starving.
Right after this, we're heading out. We're gonna take a plane for an hour, land in Eswatini, and then we have a 2-hour drive to our location to meet our Médecins Sans Frontières partners.
Of course, Eswatini was coming from a very high level epidemic. So despite all this success, it's still a long way to go. I mean, if 1/3 of your adult population is HIV positive, you can imagine what kind of problem this is for the government. At that time, when was it? I think it was like in 2010, 2008 or something like this. And life expectancy was around 30 years, 35 years. Now it has increased to over 50 years again. Good morning.
And it was raining last night, so yeah.
What time do you have to hang out? Just like 3 o'clock, right?
I need to...
Pump action.
Wow.
Nice.
Pump action, yeah.
We're not messing around here.
There's a security.
But you know what? Like, I've been in the military. If you're waving your gun like that, it better be on safety. Bernard was telling me that MSF started all here in Eswatini.
Yes.
So and now it's shrinking because it's shrinking. It's not expanding. Is it because the problem's getting lesser? Is it getting better? That's my outstanding question right now.
Well, this is definitely a question just to the head of mission who has been here till 2007. So he went through the moments in which the budget was at its peak.
Right.
And now, as I understand, it has been decreased quite a bit. So I think
Yeah.
Bernard is our man.
He's the man. I'm gonna go tackle him.
Lynn?
Yes, the Tibi Community Nest.
Okay.
I have some. Yeah, my name is Bernard. So I'm the head of mission or the country director for Doctors Without Borders (MSF) here in Eswatini. And yeah, we are now sitting in the land cruiser and on the way to Mazancheni. So Mazancheni is one of the more remote areas here in Eswatini, and we are going to visit the patient home where we treat this patient for multi-drug resistant tuberculosis. We also try to find other solutions, for patients really living further away from the next facility. Or maybe they're just patients who cannot walk. They're too old maybe, to walk every day this distance. Or just imagine you have this multi-drug resistant tuberculosis, you will just feel too sick to walk even.
Yeah.
Stubborn as a mule.
He's like, I'm not moving. He didn't move.
Wow, not even a
You
flinch.
keep a niche.
He's okay.
Man, this guy.
So we are trying to do it, but it's very much done through our lay transness.
So Blanche, we just arrived on site of a home of a patient
Yeah, correct.
that has AIDS and tuberculosis.
Yes.
And it seems like we're going to do a visit, and
Yeah, and she's only 26 years old, so quite young.
quite young. I'm feeling it today. It's really something to see. And what MSF is doing is they're making it accessible and easier for treatment. This young woman is getting the support from nurses on a daily basis. They're a phone call away, and she's taking medication for the next 3 years with hopes of going back to school, and it can't get any more real than this. Thank you. So this is the tuberculosis unit where patients are admitted for further diagnosis and treatment plans. So, what did we just do?
We just had a conversation with people that are diagnosed, or no, that have tuberculosis.
Yeah. So,
Quite,
so it's quite a thing to see, and Dr. Bernard there was talking about how the simplification of the process and how now patients don't have to come to the hospital every day.
no,
is
they can
make-
just take a pill every day. Yeah, they come here monthly, and then they will get also food package to.
To support
Yeah,
with an allowance, I think, on a monthly basis.
yeah, with an allowance.
Great.
Yeah.
Every day.
Melissa, how's lunch?
It's 3 Michelin stars.
So Justice, born and raised here in the town of Shanghai. We're having a traditional meal. And what do we have here? We have pop. Okay. Chicken. Beef. Vos, which is it's like a sausage.
Yes.
And some greens on the side.
Yes.
So how do I go about digging into this? Just pick with my hands.
Mike, don't dissect it, just eat it.
Out of the way. I pick it apart. And then I take some of this.
Yeah.
Oh, this is not potatoes.
No.
Oh, I was wrong. I was wrong this whole time.
Yeah.
You knew that, Bernard. And you let me say potatoes. What is it?
Are you sharing at least still?
Yeah, we're sharing this. We're eating together.
We sharing.
It's a combo. It's a combo.
Yeah.
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 This is amazing.
We just pop.
It's a communal dish. We talked about community today. So I really want to stick to the theme with my meal.
Mine's communal, it's all over the table.
That's it.
Reviewing agenda details before we depart to maybe some more clinics.
Edwin.
Nice to meet you.
Melissa, nice to meet you.
Introduce myself.
You see, the audio is pretty bad here, so let me explain. Being resourceful, Doctors Without Borders had to figure out a way on how to be more accessible to the many in Eswatini so they can get the treatment necessary. The health sector of the government and Doctors Without Borders work together to build these health clinics all over the place. And that's what's brilliant, is that they innovated. Well, don't hear it from me, hear it from the doctor.
So, innovation.
Yeah, we said innovation,
Yeah,
and the nation scale up with the innovations. They take it from us.
from us.
Yes.
So we
From
innovate
MSF.
here, we try new things, we
Yes.
collaborate, we
Better
co-create.
studies, and then the
we-
country. Yes, take
goes.
it from us. Yes.
Amazing.
Would have had
We
to.
walked like this all the way back to where we were.
Yes.
And how many kilometers again? 20. Yeah, over 20 kilometers in these roads. Siciniei.
Yes.
And this is where down the village has its own facility for a nurse, facility for further diagnostics and medical care, so they can have the care necessary here or that they need.
Yeah.
And then if further diagnosed for further care and support, they can go to
To Gege
the
Clinic.
Gege Clinic. I just thought about this now. You're on a mission for 8 months, right? Away from your home, away from all that wonderful stuff. What inspires you to do an 8-month mission?
I wanted to bring myself is to help people and change lives.
So that was within you before you even applied. So this just brings your purpose at a higher level. Good. Thank you. Madame et messieurs, on
On vient d'atterrir à MSF Office. Merci d'être en compagnie de MSF Car.
Ouais, c'est bon.
Et bonne journée à Eswatini.
Ça vient d'un docteur, Patrick, de MSF. So inside the communities at the health center going through sexual education and, how to put a condom on properly to prevent HIV, how to go through PrEP, which is a way to prevent HIV as well with the pill format. So openly there's a nurse with a lot of tremendous leadership. She's keeping the team engaged, the community engaged, and her voice just carries throughout the room. I feel just the efforts of MSF with such talented leaders, nurses, doctors, co-workers. Everyone's using tremendous leadership. The simple building that MSF built is saving lives. A community is now more informed. They have more access to medical care. They don't have to walk over 15 kilometers in one direction, which takes about 6 to 8 hours for the back and forth. And that doesn't include even the assessment or time at the hospital. So this makes it more simple and more convenient for them, which will encourage the community to seek that care so that we don't have to have this situation get any worse. We're gonna come do a choir in Canada?
We're going to make a choir.
I love this.
Yeah, that choir we're going to...
We'll go sing.
You are going to sing a piece.
Yeah,
Yeah.
I don't have as much of a good voice
Okay,
though.
okay. Yeah, I've got a beautiful voice.
Yeah.
Yeah. Sinomhlobo onguJesu onothando. Yeah, we are going to.
Wow.
We're going to sing.
That was so good.
Yeah.
Late night editing videos in the parking lot where the Wi-Fi was strongest. But I'm feeling good, feeling ready. We're gonna go see a ceremony today. Oh my God, it's beautiful. I think it's hurt. Or it's just really pissed off. How's her butts? It's killing you. Can't feel it anymore. Can't feel it anymore? It's been what, a couple hours, an hour? How long have we been driving? Kevin, so what was the local telling you?
So I just learned that the men are the head of the household, so they're going to eat the head of the cow at the ceremony we're going to today. In a very remote culture, the woman will eat the intestines of the cow, and this is what we will witness today.
Wow.
We're very excited to see.
Very excited.
Mike, are you gonna have a piece of the cow?
I was told I need to eat the tongue and the ears from Justice. Justice is telling me that's what a man does.
He said his favorite's the nose.
The nose.
Mm-hmm.
So I'll have some options. This is the remote health facility that the village built so that when supplies arrive, local healers can help support and give some of these medicines or test kits to the local village people.
Okay.
Yeah, I think it's about to be ready.
Okay.
Yeah, I think after some minutes they will serve.
Okay.
Yeah.
Okay.
Is that an eye?
Yeah, it's an eye. Yeah, it shows that it's coming from the head.
Is there a difference between men and women what they're eating?
Yeah, men usually eat the head and the female eat the intestines.
Okay.
Okay.
Yeah.
It's okay.
Okay. Okay. Thank you very much.
Thank you. Thank you.
On your dish?
Oh, please.
All right, show me the cow head.
So this is a part of a cow head right here.
Alright.
You can see the bones and some kind of a vessel here.
Okay.
As a doctor, what is this? Or
This
this?
looks like the stomach, huh?
That's the stomach?
Yeah.
Okay.
Okay, you got the stomach. Great.
What would you recommend?
Intestines, most likely. This one, I'm not sure what this one is.
Okay.
Okay, go for it.
All right.
Yeah.
First. That is good.
It tastes like beef. The texture is very different.
Okay.
Ryan, I'm saving some for you.
I would not want to deny you 1 second.
So it's not only a medical perspective. There's different perspectives and ways that we have to really take into account.
No, definitely. I think as MSF, of course, our main objective is to improve healthcare. But by improving healthcare, you have to be culturally adapted. So taking the culture into context, into consideration, is most important. Without, I think, health programs are going to fail.
Great. I really want to thank you for leading us throughout this week. It's a major privilege to be here and for having collaborated on the whole agenda with the IKEA Foundation and yourself.
I think it's also a great pleasure for us actually, to have visitors from outside. Also knowing that you are very important funders for us. Also knowing that and hoping that you'll still continue funding then MSF in future in order to make programs like here in Eswatini feasible and accessible to the population here. Also thank you very much.
Thank you, Bernard.
Thank you.
I have a huge sense of pride when I think about the IKEA Foundation, what it stands for. Having worked for the organization for 10 years now, it's nice to think that I can have a contribution to something bigger than myself. This opportunity to see IKEA's vision, a vision to create a better everyday life for the many, has been a life-changing one. To achieve that better life, we have to address the systems of inequality in the world. Working for the purpose-like company close to my values has given me the confidence that my day-to-day work contributes to changing lives. I will carry this memory for a lifetime. As the IKEA founder once said, most things remain undone to a glorious future, a glorious one indeed.
It's quarter past. Ibese ilapha le moto. Okay, ngawukhuluma naye
So good.
utosimikisa.
So, how do we say farewell
Okay, sure.
in
thank you.
Eswatini?
Salane kahle.
Shenanigans.
Salane kahle.
Saladagas.
Yeah.
Ah.